Okay, as we move into the final keynote of the summit, we're honored to welcome two individuals whose voices and experience remind us of why this work matters so deeply. So we're first going to have Joe Smarro. He's going to be coming up first, and then Eric Smith will be following him. So I'm going to introduce Joe, who's nationally recognized leader in mental health crisis response and organizational wellness, and he's coming all the way from Texas, right? Is it San Antonio? Yeah, San Antonio. So please join me in welcoming Joe Smarro.
All right, everybody. So if you were here this morning and left and have not come back, raise your hand. All right, so we're about like 40% capacity from this morning, and I'm not going to take it as a personal attack. I'm imagining that, yes, while Eric and I both came from Texas, you guys had very busy things you had to leave for. So I'm really excited to be here, and I'm excited that Marissa and Lori extended the invitation to me. Iowa truly is a second home for me. Over the last 8 years, I've been here a lot, and I know that there's some people in the room that I know and some that I don't. And so when we were talking about this and how to end the session for the first day, it was this idea of two sides of the same crisis. And specifically, they wanted me to talk about the response side of this, and then Eric will come up after and talk about the lived experiences side of it. And we'll mirror these two things together and make it make sense for you, but about what happens when the systems maybe don't work as well as they should together or collaborate. The theme that I want to push throughout my 30 minutes with you all, and then Eric will do his session, and then we're going to have a Q&A. But again, I know it's end of day and people are wanting to go, but we'll stay around and answer whatever questions you guys have. But the theme is going to be people, and understanding that all of us are here and we all work in different capacities throughout the state and different areas of the state doing different things, but we're all talking about the same thing. And it's how do we better impact the lives of Iowans? And that's at every level. And so all of these things that are coming up, from policy to legislation to ideas to innovation to funding, all of these things are incredibly important, but we also have to make sure that we're never forgetting the most important aspect is, why does all of this matter anyway? Why does any of this exist? And it's because of the people. And so why me? I myself actually am a consumer. I live with two diagnoses, one of PTSD and the other of persistent depressive disorder. For those of you familiar with ACEs, the adverse childhood experiences, my score is a 9, and grew up in a very, very volatile, dysfunctional family. Sexual abuse at 7 years old, followed by 8 years of physical abuse from my father, and then left home essentially around 15. And then my girlfriend's parents, 9th grade, 10th grade, and 11th grade, finally they brought me in and said, hey, I don't know what's going on, but why don't you come stay here at the house with us for a while? And I was like, thank God, finally some stability. But all I did was go to school mostly and play sports. So I didn't have a job, and I really wanted to thank them, to extend my gratitude to her parents for bringing me into the house. And so I was like, what can I give them to express my gratitude? And then it hit me. I was like, oh, I know. I'm going to get their daughter pregnant. And 0 out of 10 recommend that, but that's what happens when you have kids living together. And so I became a father my senior year of high school, and that's why I joined the Marine Corps. And so I joined the military in 2000 because going to college as a child father was not really in the cards for me. And so I joined the Marine Corps, and then 9/11 happened, and 2 combat deployments. Again, I will never be a combat decorated veteran that claims hero status. Truly invading Iraq in 2003, it really, really broke me. Being in a war setting, firefighting, it was nothing that I ever wanted to do. I really didn't understand it. The brain was not even developed yet because I was 18, 19, 20 years old. And so then I endured a lot more trauma. And then I get out and join the police department. And I spent 15 years with the San Antonio Police. But the thing I was most proud of was my last 11 years, where I was one of the original members of our mental health unit. That is a storied unit. It's a nationally recognized unit. There was a documentary put out in 2019 that won an Emmy in 2020 called Ernie and Joe Crisis Cops. It is now essentially unhoused because HBO's license expired, but it is free on YouTube. And so if you go on YouTube and put Ernie and Joe Crisis Cops, it is on there and you can watch that. I also gave a TEDx talk that if you have not been through one of our trainings, I would encourage you to watch it. I think you would get something out of it, even though it's several years old now, but it's titled I See You. And if you just go to YouTube and put in Joe Smarro, that'll pop up as well. And then I wrote a book last year. It's called Unarmed. And while people assume that it is a police book, it's not a police book. It is a resource that I provide to everyone that we train. I brought 5 copies with me. I'm not here to take your money. I'm here to give them away to you for free. But if you actually read, then I want to give you a free copy. I'm happy to sign it for you. I'll give it to you for free. If you are a hoarder, do not ask for a book just because you want to collect some stuff from the conference, all right? I would prefer that you actually read it and then share it and get something out of it. And so, again, I did bring a few copies with me, and I'm happy to share that with you all. And then, as I mentioned, I'm kind of sort of an Iowan. Since March of 2017, I've been coming here. It started out in Johnson County, auditing their CIT program, and then it went up to Black Hawk County, and then we were down in what was formerly the South Central Behavioral Health Region, in Ottumwa and Oskaloosa down there, and then started coming out further west, and then got heavily involved in the Dallas County area, and really just penetrated I-80 from Pot County all the way out to Quad City area, but we've been north and south of I-80 as well. It's just the thing that has always bothered me the most, and I know that I'm probably singing the tune of many of people in this room that live in the more rural areas, is that so many of the systems, and this is a microcosm of our entire nation, is that it's easy to put a lot of resources and effort, and this is both in talent, in funding, in services, where it's most populated areas. Right? What happens in Polk County is very different than what happens in Dubuque or in Sioux or any of these other rural areas. But yet they are still dealing with the same problems. Maybe it's not the same scale, but it's the same problems. And these arbitrary boundaries that we have around counties and cities and these lines that are just made up create massive friction. And even from a training component, because currently now I'm the CEO of Solution Point Plus, and it is a training and consulting firm that operates at the intersection of public safety and behavioral health care. So we've provided a lot of the training that I've heard since sitting here today to the first responders, to the behavioral health providers, and in de-escalation, in crisis intervention training. We've been doing it since 2017, and I'm incredibly proud of it. And what I will say is, the thing that's unique about Iowa and why I claim this place, and everywhere we go and talk, people are like, why Iowa? And I'm like, I know, it's amazing. Like, I have no idea. But here's the reality, is historically, Iowa has not had the same level of bureaucratic red tape to just get things done that every other state seems to have. And things just happened much faster. There was a decision that needed to be made, somebody wanted training, and they just hired it. And every other state, it's very different. There has to be different processes. There has to be RFPs. There has to be all this stuff. But what I'm most proud of in the state that what we've done here is from 2017 to up to a couple months ago, we went from just providing a 40-hour CIT training to then saying, okay, we now recognize the need for more, to then providing a 2-day intermediate de-escalation training for the social workers and behavioral health types. Then we realized, nope, they need more than 2 days because they have to understand more on serious mental illness. And if they're going to be doing co-responder capacity or they're going to be responding to the community, they have to better understand crisis context, not just the DSM. And so we added a 3rd day in advanced de-escalation. And then it expanded to go into a 2-day training for dispatch and telecommunicators. And then it went into the schools with our Michelle White training for child and adolescent mental health training. And then it's just continued to expand into corrections, into all these things, and it's been phenomenal. And I was cautiously optimistic with the new evolution in PCA coming and all these things, because I was like, yeah, this is, in my mind, the only good things can come from change. But what I learned about people is we hate 2 things. We hate the way things are, and we hate change. And so it makes it very hard for the decision makers, for people to come and be like, hey, we got a new idea. And we're like, I hate everything and whatever you're going to propose. And you're like, no, hear me out. And like, no, I hate that too. And we don't even know yet. But change is scary. And again, we are caught up in this as well. And there's uncertainty of like, okay, what is going to happen with this training? But I want to talk about the response in this talk and what could possibly happen and kind of paint a picture of what I'll call utopia. And I mentioned this, right? Every system, every acronym, every decision, There's people behind these, right? The people in crisis, we got hired a while ago to do some consulting here in Iowa, doing a needs assessment, and I said, if I am the consumer at 2 a.m. on a Tuesday, let's walk through what's going to happen. Because us sitting in this room as experts, as professionals, telling them what's best for them is not going to ever be the best practice. It's never going to be the best practice. We need to bring people with lived experiences into the fold to say, okay, what's reality? The reality is if it's 2 a.m. and I'm in crisis, I'm going to call 911. Okay, is that feasible? Is that the best thing? No. So what's the alternative? As of late, it's 988. Okay, do they know about 988? No. All right, so we have to do an awareness and an education campaign here. So then, okay, what happens when they call these places? When they call 911, are the dispatchers trained? No. All right, what happens when they call 988? Are they going to answer? Just so you all know, Iowa is doing really well in the 988 response just to answering the phone. In Texas, it's about 67% of the 988 calls get answered, which is not great. Now, again, this comes down to population and size and scale, right? Iowa, that like just 2 cities in Texas make up the whole state of Iowa, and so obviously it's a different scale, but still, like that's a staggering statistic to understand. Like most of these 988 calls, or not most, but over 30% of them are not even being answered. That's a problem. All right, so then when they call these, then what happens next? All right, so then where are they going to go? They're going to go to a hospital. All right, so does the staff at the EDs, do they get trained? No. Well, that's important. This idea of, I heard Leslie talk about it, but the streeting happens in so many places, right? San Antonio gets a lot of credit because we're doing a lot of great progressive work, but there's also always something happening behind the curtain. It's always like a duck on the water. And anytime we would do tours and people would fly from around the country to come to San Antonio and look at our progressive models and how we all work together, like we can all show up and say our sound bites, but the reality is real things are still happening. Why? Because every system is made up of people. And people have bad moments. And it doesn't matter that you have a policy in place. This is a huge problem in healthcare, is that hospitals can have policies in place, but you have traveling nurses, staff that don't belong to that facility. They're just coming in and working, and they're like, yeah, I'm not following that. We're going to do a UA. Oh, there's amphetamine. This is all it is. Let's treat in the street. And it's like, well, wait a minute, right? Why are we using that? Well, the hospital can take a stance that, hey, it's not our position to treat them. We're just stabilizing and releasing. So then it comes back to it's not a crime. I found it interesting. I always love listening to Leslie Carpenter speak. But I find it interesting in listening to her story again, and I've heard it before a couple times. But it's like when we deal with people, especially on the higher acute side of things, like the serious mental illness, the severe mental illness side of this complex population, one of the things that we all agree on is like, well, they lack support. They lack support. They don't have community. They don't have family. They don't have the support on the back end. And then the very systems create friction from not allowing the families to actually support them. When she says HIPAA, and there's a lot of people, again, in training law enforcement, like, everyone just says HIPAA, 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 can't talk to you, HIPAA. And it's like, well, HIPAA actually teaches you how to talk to us, right? Especially on the law enforcement side. And so there's a lot to understand and learn from that as well. And so when we know we need community, when we know we need family, oftentimes, again, families are the ones that get left out, which is why I'm glad Eric's here to share his story after I'm done with this portion. We talk a lot about silos, right? Nothing unique here in the great state of Iowa. It's predominantly farmland throughout the state, and there's a lot of silos. But if we look at what I just narrowed down to the 4 main silos that we see and operate here, we've got the law enforcement and public safety silo. We've got the behavioral health and human services silo. We have the healthcare and primary care silo, and then the courts and justice system. And what's really great is if you were to go into any one of these silos and just look at it through their frame of reference, they would be crushing it. They're like, we are doing great things, right? The police departments, we got co-response, we've got embedded clinicians, we've trained people, we're responding with empathy and compassion, our use of forces are down, like this is incredible. That's great for them. But then you go into the next silo, and they're crushing it too. The problem is when we don't actually communicate together. The problem is when these systems don't operate efficiently and when they don't communicate effectively to one another so that we can understand things that are happening. And there's all kinds. I'm such a fan of not ever trying to reinvent the wheel when we know that we have systems that already work. But yet, because of human ego, There's people that want to say, no, we're going to do it this way. Why? I have no idea. We're just going to do it different. But don't we know that it works this way in a very similar area with this very similar population, with very similar laws, and we know it's effective? Can't we just like carbon copy that and put it here? And we're like, no, let's complicate it. Let's make it way harder than it needs to be, and we're going to do it this way. And so then there's frustration. There's all these missed opportunities when we get in our own way of creating systems. And again, the thing that gets lost through all these is the people that are actually utilizing them. Because I'll tell you, from the consumer standpoint, as a patient of the VA, I am a huge advocate, like Leslie is an advocate of state hospitals. I know our state hospital in San Antonio also does some great work. It's helped a lot of people. And it doesn't mean that everyone that's ever gone there has always had an incredible experience. I am a huge advocate of the VA because of what they've done in my life. And it is a huge pain in the ass to use every single time. And like, I'm pretty lucid. I'm a pretty sharp guy. And every time I need an appointment, it's like you have to schedule 3 appointments, wait for 2 callbacks, file something online. And I'm like, this is the worst, most archaic system. There's no way if I was truly like sick and not had all my faculties, I would be able to navigate this system. It's so frustrating. But it doesn't mean that like there's not good in it. It just means there's room for improvement, right? I always tell, anytime I hear someone say like, the system's broken, I'm like, hold on. That implies it ever worked, right? The system isn't broken. It's never worked. Every system has systemic issues. Every system. The public health system, the behavioral health system, the healthcare system, the criminal justice system, every system has systemic issues because systems are created by people. And there's always going to be a class or a group or a type of person that gets left out, neglected, forgotten about, not taken care of, whatever it is. All systems. And so fairness is always going to be a huge issue. But again, when we look at this, we have to remember the people that are outside of all of these silos that we're operating in. And just because we can look at our own house and say, yeah, I feel real good about this, do we understand everyone else's side of this? Do we understand what everyone else is doing? Do we understand the healthcare side? Do we understand the court and judicial side? Do we understand what's happening and why? Too often we just operate from our own frame of reference and play small. I want everyone to close their, not really, but like let's just play a game where we can like paint utopia, right? What would Iowan utopia look like? Now you guys continue to rank as like one of the greatest states to raise a family, which is awesome. Right? It's incredible. And I get it sometimes until I'm here in February or March, and I'm like, yeah, this to me is a significant threat to humanity. And I don't know why, and I'm from New York originally, and I'm like, yeah, that's why I didn't go back there after the Marine Corps. Like, you have a choice. And you chose this life. And so it's like, yeah, the winters are harsh, and they hurt my feelings. But from a system standpoint, right? When I think about utopia, and I'll be honest, about 3 years ago, we were really heavily involved, doing a lot of training throughout the state. Again, in parts of Iowa, like Bloomfield. I don't know if anyone here is from Bloomfield or been to Bloomfield, but my first experience at Bloomfield, Iowa, it was the first day. We're at a training. We go to lunch. You have like 2 options. We're at a Pizza Hut that's like in the back door of a Dollar General, and I'm sitting there, and I tell my partner that I'm with, I'm like, yo, Jesse. And he's like, what? And I was like, Pilgrims just walked in. And he's like, what? And I was like, there's pilgrims here. And he's like, what? And he turns around, he's like, dude, those are Amish people. I'm like, what is happening? Culture shock, right? I was so shocked. I was like, where am I? What has happened? So we have been throughout this state, in the corners, in the middle, in the populated areas, in the rural areas, and truly, it like has significantly impacted my life. I've met friends here, lifelong friends here. Like, I love this place. And one of the things that, because we were doing so much work in training people and meeting people and identifying their needs and causes, one of the things is like, man, my utopia would be something that I wanted to affectionately call the Iowa 360. And the Iowa 360 to me was looking at, which I know you're going to get a block on tomorrow, which I love, and I've already heard it referenced a couple times today, but the sequential intercept model. And if you just look at that, so our company is founded on that sequential intercept model of looking at each intercept point saying, can we offer something at each point? Is there a training that we can offer at each point? And the answer was yes. But I realized it wasn't happening here. It's not happening anywhere to my knowledge, and not from any one company or place. A lot of people, and this is a true story, and this is not like 19 years, no, this was 2 years ago. There's a mandate in the state, unless it's changed in the last 2 years, that law enforcement has to have 1 hour of mental health training annually. And in talking with a sheriff in an undisclosed county, he told me that, he goes, Joe, we don't have the staffing, we don't have the resources, we don't have the training, we don't have the knowledge. And he said, I have them watch an episode of Law and Order, and I count that as their mental health training. And he's not even being funny. And I'm like, yeah, that's a problem. He's like, I know, but what am I going to do? And I'm like, yeah, man, this is not okay. And so for me, it was like, this is where it started getting the wheels turning. And also working with them, it was like, who do you guys partner with? The social workers, the clinicians, the behavioral health providers, people like Easter SEALs and the groups that we've worked with, again, in these areas, and all the countless people that we've trained, regardless of where we worked at, in training their staff. But the Iowa 360 was like, what if we looked at, okay, I believe in prevention is the best intervention. And so we start in schools. To me, like if I could reform one thing in this country first, it would be public education. I think we need to learn about brain health, age appropriate, and truly learn about like how to live in society. Standardized benchmark testing, not for me. So public education, like if we could do something for the schools, not just the SROs, but for the school staff resources, cool. Then it's like, all right, 911, check, we've got that one, because that's where people are going to call. Law enforcement's the de facto responder to most crises that happen across America. And until we have a massive amount of funding poured into, even with 988, I promise you, not everyone in Iowa even knows 988 exists. I promise you they do. I bet you every cop in the state doesn't know 988 exists. I guarantee it. And not everyone knows about it because we don't have enough on the education side. So then it's also whoever's going to be that first point of contact. Then it's the responders, whether that's public safety, it's fire also, it's EMS. They should be on the same page. Then it's where are they going to go? So then the receiving facilities, whether it's just hospitals or the inpatient facilities, outpatient facilities, wherever they're going to be going to, or even the jails, right? Every single point should have some type of training. And I was thinking up this idea where it would be standardized, so we're all speaking the same language, we're all on the same page, doing the same thing. And that way when we talk about response, it's not just based on your zip code. Because right now, that's exactly what's happening, not just here, again, this isn't unique to Iowa, this is everywhere, is your response is based on your zip code. It's based on what resources you have, what funding you have, what talent you have, what access you have, what capacity there is, what bedding capacity, all of that stuff comes into play based on zip codes and areas. And so the response is going to be specific and determined on that one factor. And so at Intercept Zero, again, just talking about the community services prevention, law enforcement emergency services, pushing because you guys are going to get all of this tomorrow. But I think this is super important. And again, for those of you not familiar with this, with the sequential intercept model, it's something, again, SAMHSA put this out, but it's just a simple, like I treat it as a heat map. And if you just lay this over your county or your area or your district or whatever you're in, you can start looking at this and do like a genuine audit. Not as like a gotcha, not as a finger pointing, not as an attack, but as an opportunity to find areas for improvement. That's it. Like how can we improve our systems together, collectively, right? Not waiting for hope and just thinking like, the federal government will bail us out, right? You guys are 25th in the country for federal funding. So you kind of fall right where you fall geographically. Like you're just right in the middle, right? You're not the best, you're not the worst, but you just like, you're right in the middle. And so like, okay, that's good, but it's not great. And so then you have to get creative. But it would also be nice if there wasn't so much of this work just dependent on grants. And so when I look at the remaining gaps, which I think are opportunities, the big things that come up beyond training are also things like transportation. Right? I heard a question come up earlier about this, like how are you getting them there? And to me, transportation is a huge level of friction when it comes to getting people adequate care they need. It's not just about, hey, you have an appointment in a week and they're likely to forget it, but like, how are you going to get there? One of the units, and I'm happy to talk about whatever during the Q&A, but one of the things we did before I left the department in 2020 to focus full time on this, we had just like you all have system navigators, right? We created a navigation program in our department, but it basically put a licensed clinician at our dispatch center 24/7, and any police officer that ever put a behavioral health patient in the back of their car had to, by policy, call this one number. And the clinician could see every one of our facilities. We had about 22 in the city that they could go to, and they would do a geographical ping on them. Where are you? 3-minute triage. Who is this person? What do they got? What do we know? The clinician's looking them up quick. Is this for continuity of care? Do we need to bring them to the same facility? Or is this someone that we don't really know yet, and based on the acuity of what's happening, we can get them to the nearest appropriate inpatient mental health facility or most appropriate facility deemed suitable by the local mental health authority, as it read. But they took the autonomy out from the officer. Why? Because cops are going to do path of least resistance. I'm going to do the easiest thing. If I got an ED in my district right here, I'm going to just take them there. But if I know what's best for this patient is for me to drive him 35, 40 minutes across town, that's less likely to happen. But if you make me do it, I don't have a choice anymore. And so that program worked really, really well. Then we had what we called IMPACT, which was the Integrated Mobile Partner Action Care Team. This was a mental health unit officer, a paramedic, and a social worker. And we proactively identified our top 100 utilizers in our city that were using the most resources. The top person had over 330 ER visits in 1 year, 700-something 911 calls costing $2.7 million in a year. And we said, hey, we know they're going to call 911. Why wait? Let's show up. Let's proactively engage them relationally and get ahead of the 911 call. And we saw a 67% reduction in 911 utilization from our top 100 utilizers. Massive cost savings there. And the hospitals actually funded that. They ponied up $2 million without even blinking because it's like, wait a minute, you're not going to bring all of the people with mental health issues to our hospital? Like, it's possible. And they're like, take all my money. Like, just, yes, whatever you got to do to not bring them here. And so it's incredible what can happen with collaboration and innovation and thinking outside the box. And so these cross-cutting sectors across those intercept models, again, I think hospitals play a super important role. It was always frustrating to me. We do all this work training the responders, training the clinicians to go out and treat people well, to treat them, focus on the person, not the problem, right? The goal is connection before correction. I was so proud in my 11 years on the 7th largest city in the country, 11 years on the mental health unit, over 8,400 call-outs, not one use of force. I was proud of that because of my ability to really want to connect with them on a human level, my ability to understand that, like, facts tell and stories sell. And so to humanize that approach, I'm Joe, I'm not Officer Smarro, I'm here to help you out. You're not in trouble. And to get them into the system, even if they had anosognosia, even if they refused to believe they were sick, how could I get them to do the thing they didn't want to do and empathize that? I was super proud of that. But the thing that was frustrating was then you do all this work, you put them in a pretty little box with a nice little Tiffany's bow on them, and you bring them to the ED, and the nurse is like, all right, what do you got? You want to kill yourself? And they're like, no. You want to kill someone else? No. Then why are they here? And it's like, well, there's also third criteria, and you probably should quit. Like, what is wrong with this person? Like, they have just no empathy, horrible tone, and that's the first thing that this person that I just like smooth talked for 40 minutes and told them, like, hey, and then I got in the habit of saying, I can't guarantee what's going to happen when we get there as far as like the attitude or the personality of who's going to be there, but I can tell you what's going to happen, like, systematically, right? They're going to take your vitals, we're going to change you into a gown, we're going to wait for the doc, they're going to take some vitals and stuff on you. I can tell you what's going to happen to you, but I can't guarantee what person's going to be there when we get there. And so just please understand that, like, I'm with you on this journey for now until I got to pass you off. And if we meet someone like that, like, we're going to meet them with grace. But just using guided imagery to plant those seeds, like, that's such an important part of the response factor because, again, people are going to do people things. You're going to meet people on bad moments that just do some wild things where you're like, goodness to me. And so I continue to see that as a huge gap is the receiving facilities and just their lack of, and again, I can empathize with them. Think about this. If you're a triage nurse in an ED, I promise very little of your training was in mental health, right? It's all about, like, stop the bleed and life-saving stuff. And so much of what you're getting is just like 41-year-old Gary who's depressed because his wife left him and he's thinking about suicide. And you're like, what? Like, what do you want me to do with that? Like, that's not nursing. Or you get someone who's very sick and they're acutely, they're fully detached from reality. They're floridly psychotic. And the nurse is like, this is going to be a pain because it needs one-to-one because now we don't have the staff and now you're just frustrating me. And so now we're just mad about it, right? And so the system just gets constrained on each one of these levels. And again, when we think about the response factor in this, I don't want us to forget that when I talk about people, it's also us. It's also us. And that we could pause and be more mindful of our role that we play in the system of care. And so as I was building this talk, after Marissa asked me to do it and Lori asked me to do this, I was like, yeah, I'll talk about the response piece, cool. And I like to think creatively and, like, this is an opportunity to, like, share my heart and share, like, what I believe could genuinely help people. And not that I'm trying to, like, create slogans for you, but something that stood out to me was this idea of, like, one state, one standard, right? Just because we're not trying to change the world, we're not trying to change the United States of America, we're trying to truly impact the state of Iowa. And if we just had one state, one standard mentality, and every single responder, every single receiver focused on this consistent, compassionate, and connected response, that we could all get aligned, the systems could be aligned, people could be aligned, and that they would start to know exactly what to expect when I go into crisis next. Or if I have to make a referral as a family member to a loved one and they go into crisis, I know exactly what to expect because the systems are aligned. And when our systems are aligned and our people are aligned, amazing things can happen. And we can do it, again, by focusing on these 4 pillars. We've got system alignment is super important, community collaboration, sustainability is huge. I love that someone brought this up. I don't remember her name, but she was like, hey, if we prove over the next 24 months something is effective, let's not turn off the money. It's amazing to me that in this field, there's so much grassroots work that has to happen to create any change, that we're constantly seeking out grants, that we're having to find money, that we're having to beg and borrow, we're having to get creative in our funding, whether it was formerly through tax levies, or it's however we're finding our money, or it's through the federal dollars, or now it's the state dollars, or it's whoever's funding all of it. It's never enough. It's never going to be enough. Because as Leslie shows you, 49,000 people with serious mental illness or severe mental illness just in this state left untreated. Do you think that those 49,000 people are just home minding their business and they're never going to influence any of these systems? No, they're absolutely, they are the most taxing at every one of these systems. And yet they have the lowest level of treatment. Why? Because there's disparity and there's a lack of equity in our healthcare system, because we live in a society that just simply factually is true that your level of care is solely dependent on how you pay for that care. And if you are indigent and unfunded and you don't have any money and you're unhoused, it's going to be very hard for you to get the level of care you need. Whereas if you are a sole funder and you've got good money and good insurance, you can get the highest level of care, the worried well types. And so as long as that disparity exists, it's going to be very hard to reach those 49,000 people and give them the treatment that not only they need, but they truly deserve. And so there's a huge cost and burden, not the people, but to the systems when we have this level of a lack of treatment. And then innovation, which again, I think is a part of what you're doing here today. I think it's a huge part of what PCA is wanting to do with the going to these 7 districts and all of the effort that's being put into through the DCAs and these council advisories to figure out like what is happening, what is working, how can we improve these systems, what's good, what's bad, and not just trying to hammer everything, hopefully not a statement that's going to bother anyone here, but not handle it like Doge, right? Doge came in with a sledgehammer, and there's from a business standpoint, it was wild. Like if you had the word consultant in your private business name, you just lost all your money. Like I have friends that are in business and just millions of dollars gone because they had consultant in their company name. It's wild. But when you handle problems with a sledgehammer and not a scalpel, you're going to get these types of wild results. And so, again, I appreciate the fact that there was real attention and effort put into the change. This wasn't just something you woke up one day, you're like, aha, gotcha, you're no longer in charge of anything and you have no say. There's real effort being made to actually improve the systems of care and the response to them. And so as I begin to wrap and pass to Eric, I just want to leave you with 2 things. One, remember that we're in this together. And I know you're like, Joe, you're going to fly home tomorrow and you're going to go back to Texas and like, what do you mean together? I cannot overstate this. If I'm never hired in this state again, I still love Iowans. I still will show up for Iowa. I still will advocate for Iowa, and I'll still be back in Iowa however I can because I have friends here. And I genuinely care about this place. But we cannot ever forget that no matter what happens, whether we agree with it, disagree with it, understand it, don't understand it, we're in it together. And and just as I tell cops when I train them, I meet a lot of miserable cops. And I remind them, like, hey, you all realize none of you were drafted. Like, no one's forcing you to do it. If you hate it so bad, why are you going to come back and do it again tomorrow? You're like, I just choose anger every day. You're like, okay, right? I mean, we have choices, but I just think that's no way to live your life. And if you can be real honest with yourself and remember your why, remember why you started this in the first place. Yes, systems change. Yes, things change. Yes, things can be difficult. But don't forget, you also changed. The way you think about people changed. The way you think about yourself changed. A lot of things changed, us included. We're in this together. And with that, I'm going to pass to Eric. If you want to, again, Eric's going to do his time. We're going to be after here for Q&A. I've got books if you want them. If anyone wants to connect with me, you can scan and connect. My email and phone is there. And now Eric's going to come up and talk to you about what happens when systems do not collaborate or work together. And so I covered the response part, but now we're going to hear from a lived experience part. And so I welcome my friend Eric Smith. Thank you, buddy.